Well, John, you're there in Moscow, Russia. For people who haven't seen you before, you're the former Palm Beach County Sheriff's deputy who is now an American expatriate in Moscow. How are you feeling today, John?
I'm feeling a bit rough today, to be honest.
You've been diagnosed with coronavirus, COVID-19. You're the first person I've spoken to who has that condition. How does it feel?
Well, it's not so bad as I thought. Um, I guess it could be a heck of a lot worse, that's for sure.
Well, what do you feel? I mean, what are the symptoms? What was your first indication that you were having this?
So, about 3 weeks ago, I went to immigration, and there were a bunch of Chinese people there. They actually kicked me out because they were all wearing masks, and they told me not to come back until I got a mask.
Really?
And yeah, and I went back like the next day, still like a ton of Chinese people. I had a mask, and I didn't feel anything for at least a week. So about a week later, I woke up. I was tired, and I didn't feel like great, but I just figured, okay, well, whatever. And then I started feeling good again, and then I felt like pretty bad again. So I called the doctor, and they sent over the coronavirus people. Yeah. So yeah,
So
there
you've
you go.
shared some photos with me. Who took these photos? This is after they tested you and they were wiping down your apartment building or something?
Yeah, yeah.
So you took the pictures.
Oh, no, no, no. Someone else did.
Hmm. And what did the test involve? They came to your apartment. You've told us in previous videos, or perhaps it was videos on your channel. For people who are seeing you for the first time, John, they can find out more about you on YouTube by searching for John Mark Dougan. You created a website called pbsotalk.org, which was a whistleblower site along the lines of a WikiLeaks type of thing where people could anonymously post information. You got a lot of information about corruption within the Palm Beach County Sheriff's Office, including solicitation of prostitutes, theft of items from the evidence room, including illegal drugs. And they basically ran you out of town. This is why you're in Russia, correct?
That's correct.
Yeah. And so, before we go into more details about your diagnosis, what's life in general like in Russia right now?
It's pretty normal. I mean, there's not a lot of traffic on the roads. Actually, a shockingly small amount of traffic.
Hmm.
But there is, every all the stores are working. All the stores have stuff. So it's life is pretty normal here.
You haven't noticed a major disruption from the worldwide, panic related to coronavirus and the pandemic. You posted this video on your YouTube channel showing a very calm looking supermarket with some beautiful produce. There's a stark contrast, John. When you and I were little kids, I'm sure you remember seeing pictures of the former Soviet Union, long lines outside the supermarkets, people waiting for toilet paper, didn't know if they were going to get toilet tissue or meat on that particular day. Seems like the tables have turned quite dramatically. What do you say about that?
Yeah. Oh, like in Russia, you mean? Yeah, definitely.
I mean, yeah, between Russia and the United States, big turn. People are concerned
Yeah.
here.
It seems they switched places.
Yeah. So you look generally okay. You don't seem like somebody who's dying from this very scary virus that has the world turned upside down.
Well, I don't think I don't think most cases are indicative of the what's causing the mass panic everywhere. I think most people are going to get this. They probably don't even realize that they have it. And this brings. I did another video about coronavirus, and this brings up a very important question or an important point where look, if 5 people die from coronavirus and they test 100 people, that's 5% of the population, right?
Mm-hmm.
But if really 1,000 people have it and the other 900 people, they don't even realize it, or they just don't get tested and they're a little bit sick, so they don't get tested, then those don't show up in the statistics. And it's really, and that's what's happening with coronavirus right now. So they just the people don't realize how many people are actually sick. And I can tell you, there's a lot of people that have this that haven't been tested, so they're not reflected in the statistics.
Mm-hmm.
And as far as the mass panic goes, Russia's done a really excellent job managing the coronavirus problem. They're releasing information. They're not scaring everybody. Um, they're putting up like in the metro system. They're putting up stuff about, yes, this is a pandemic. There are other pandemics also. The flu.
Right.
Don't panic. Don't hoard. Just be normal, but be careful.
Right.
And they're limiting like large gatherings, and they're telling people, but people know to avoid these gatherings anyways. So I think they've done a really good job managing it, and that's why we don't have the same problem in the supermarkets, in other stores that you're having there in the United States.
Mm-hmm. Now, John, there's this Johns Hopkins. I guess this is data from the CDC and the World Health Organization. They've got a total of 306 confirmed cases. Do you know if that's counting you?
Where, in Russia?
That's what it says, according to.
Well, this is my point. I mean, the point is there's a lot more cases than what's being reported, not only in Russia, but everywhere.
How do you know that?
So, I mean,
But how do you know
it just,
that?
I don't know. I mean, I guess it's supposition on my part, but look, how many of these world leaders are sick, right? These people in top positions.
I don't know.
They're getting it from somewhere.
But how do we know they're sick? We're just hearing some report that they're sick. Now, we've got you here firsthand. You can tell us, how are you feeling right now? You look totally normal.
So look, I got a really bad headache. My lungs feel like they're on fire. I'm tired as hell. I've got a little bit of a fever. But other than that, I mean, I'm not I'm not too terrible,
Mm-hmm.
When I lay down, I try to sleep at least sitting upright a little bit. Otherwise, it burns. I don't know if like there's fluid in there or what, but I haven't felt so bad where I feel like I need to go to the hospital. I mean, when the coronavirus people came to test me last week, they wanted to admit me to the hospital. And they said, "Oh, well, you're going to be there for 14 days." And I was like,
Ooh.
"Oh, no." I was like, "Can you just quarantine me at my house?" And they said, "Yeah." So if I get a lot worse, then I can just call them back and go to the hospital. But I haven't felt the need, I haven't felt the need to actually go.
Mm-hmm. And what did this testing procedure involve?
So they take a long cotton swab and they swab your tonsils, and then they take some furry brush and they stick it up your nose.
Hmm.
And that's it. I
Did it
mean,
hurt?
no blood, nothing like that.
Did it
And then I
hurt
don't know what
jamming
they
that
do when
thing in
they're
your nose?
Huh?
Did it hurt jamming that thing up your nose?
No, I tickled actually.
Huh. Wow. Okay, so you say that 306 cases is too low for Russia, but that's based on just sort of reports you're hearing from the news there, or what do you base that presumption on?
I I mean that's just an educated guess.
Mm-hmm. So you went into the immigration office there in Moscow, and there were Chinese people there. Did you get close to them? I mean, do you feel like you're now aware of the moment where you contracted the thing?
No, I mean, I wasn't too close to anybody in particular. It wasn't like I was going up hugging people.
Right.
And I didn't want to sit down because the first thing in my mind was like, holy Christ, there's a bunch of Chinese people in here and they're all wearing masks. Great, you
Hmm.
know?
Hmm. So Anne is in the comments asking, did she understand correctly that you got tested a week before you felt bad, or did you start feeling symptoms and then
No,
call for the
I
test?
got tested. I get tested about a week after I started feeling bad. I got tested 1 week ago.
Hmm. And what were the initial signs that you were feeling bad? Pain in your lungs, headache?
Well, that was when I decided to call and have the coronavirus people come over. Yeah. But initially, it just felt like I was run down and tired.
Hmm. All right. So what's your impression, John? I mean, you grew up your entire life. You've only been living there in Moscow for a couple of years. You grew up your entire life in the United States of America. Have you been watching any of the news? Have you seen any on YouTube? What's going on over here? It's been a radical transformation of life.
It
Everybody's,
it's havoc. It's absolute havoc. And you know what? The media, the Western media, doesn't do anybody any favors when they're reporting, like sensationalizing their reporting, making everybody worry sick. Because look, yeah, some people are going to die from this virus, just like some people are going to die from the flu.
right.
But the vast majority of the cases are not. And the media, I mean, they need to like chill out and stop causing so much fear in everybody. That's the big difference of the reporting there and the reporting here is here you can go to the store, you can buy toilet paper, you can buy everything you need and not worrying about long lines and chaos.
Yeah. No, absolutely. A pretty shocking development that I'm not quite sure that people, including myself, fully appreciate just yet. There's been another major development that I've been talking about, but most uh, news outlets here in the United States haven't been discussing it too much. The president of Russia, Vladimir Putin, was at the OPEC Plus summit back first week of March, and he basically refused to comply with the Saudis' request that Russia cut its oil production to keep the price per barrel high. Saudi Arabia needed the price to be around $50 a barrel for them to be profitable. Russia is able to profitably produce a barrel of oil for $30 a barrel, and obviously anybody who wants to buy oil would rather pay less for it than more. There hasn't been very much attention on this, but you know, John, it's my feeling that when Vladimir Putin did this, it not only was a shock to the oil price and lowering the price and affecting the oil market, I think this has had a tremendous impact on the petrodollar system, which is essentially a price fixing scheme uh, enforced by the United States, created by the United States and Saudi Arabia via OPEC. And this system is basically what gives value to the US economy. It's my personal feeling that by rebuffing the Saudis, Putin has essentially assassinated the US dollar. And I believe what we're seeing is a very serious economic crisis. Has there been any conversation about Mr. Putin's reluctance to join the price fixing cabal with OPEC?
You know what? Vladimir Putin is a very independent leader, and his one interest is for Russia. You know what? The United States has opposed sanctions on Russia over what amounts to fraud and lies. Um, you know, there's no reason in the world, if I was Vladimir Putin, that I would say, oh, you know what? Yeah, I'll just do what the United States says and I'll keep their, you know, look, he's watching out for Russia. The United States, they're not watching out for Russia at all. I mean, they've had sanctions against them. They're scripting, they're making up this garbage about these phony Russian hackers, which I have some very interesting videos on my
I want to
YouTube
talk about
channel.
that too. Yeah.
Um, and you know, it's garbage. It's absolute garbage. And it's very interesting that the day after I put out my evidence about DC leaks, where I show a paper trail that I have for the server, that the United States government decides to drop charges against the company that they say was involved in a lot of this stuff. I mean, it's just ridiculous, you know.
Right.
So I have no I have no I guess love loss for OPEC and the American government as far as this. I mean, it sucks that the American economy is hurting because of it. But you know what? They've done nothing. These nations have done nothing but try to crush Russia's economy since 2012.
Well, how about 1993, right before Perestroika? The Soviet Union fell in part because of the United States hegemony and the ability to manipulate, basically world economies through this system. The thing that's really interesting to me, John, is again, I'm not an economist, but this is my opinion looking at everything that's happened. We have seen other challengers to this petrodollar system. We saw Saddam Hussein sell oil for euros just after September 11th or right around the same time. And people will recall that George W. Bush, in a mysterious, I don't know how people believe this, but he blamed Saddam Hussein for 9/11 and then attacked and destroyed Iraq over allegations that they were somehow involved in 9/11. Again, it's my personal belief that that was done because Saddam Hussein had begun selling oil for euros, and they couldn't allow that challenge to the petrodollar system. We then saw the next challenger was Muammar Gaddafi. He, as the president of the African Union, created the gold dinar, which was intended to be the currency for African nations to compete with the dollar and the euro on the international stage, and it was to be the only currency for trading African oil, and we know what happened to Gaddafi. The thing that's different about what's happening now, if I am correct, and this is Vladimir Putin challenging the petrodollar system, he's the first nuclear-powered challenger to the petrodollar, and he cannot be simply dismissed by the United States or murdered. So I don't know. Has there been any talk about this, about Putin's involvement at OPEC Plus, or how's nothing?
No, I mean, look, for the last 3 weeks, I've been holed up here. I haven't talked about much about anything with anybody. I've just kind of been laying around feeling crappy on my couch. So,
Right. I think a lot of people are doing that same thing here in the United States, even if they do not have coronavirus. A lot of people are concerned about their jobs. The government has been telling various types of businesses to close. Andrew Cuomo told restaurants to close. Look at this. This is an article from The Guardian talking about Iraq netting a handsome profit by dumping the dollar for the euro. And it goes on to tell us that almost all of Iraq's oil exports under the United Nations Oil for Food program have been paid in euros since 2001. Around 26 billion euros has been paid for 3.3 billion barrels of oil. So that's interesting.
it is, yeah. But look, people here are worried. Because they're talking about shutting down the city for a week or two, starting on Monday. Um, and it's no different, but they're preempting all this. They're doing learning and education from home. Um, so they're putting all these systems in place so that there is somewhat of an infrastructure so that all these jobs just don't shut down. Of course, the service industry here is going to take a big hit. But look, because of the sanctions, Russia has gotten a lot more self-reliant, and that's a big problem where I think the United States has. The United States is too much of a global economy. They're not nationalist enough, and because of this, they're completely self-reliant on China. And
Right.
this is like with the medicines and all this other stuff. And this is really bad. This is a really bad thing for the United States. Whereas because of the sanctions, uh, Russia has already put in place the infrastructure to be much more nationalist and much more self-sufficient. So I don't think Russia is going to be hit as hard by this that the United States is going to be hit. That the United States is going to be hit.
Mm-hmm. And Chris is joining us here in the comments. He wants to know, he or she wants to know your vaccine history. Do you take flu shots or anything like that?
No, never. Actually, I shouldn't say never. I took one flu shot back in, I think it was like 2000 or 2001, and it made me violently ill. So I just decided never to take a flu shot again. I just figured if I was going to get a flu shot, I might as well just get the flu. So,
Right. I agree with you on that. And when you immigrated to Russia there, did they force you to take any inoculations or anything like that?
no?
It's interesting.
Yeah.
So let's change gears for a second, John, because the other thing that you've been speaking about on your YouTube channel is you told us about the FBI is lying about DC leaks. When I saw that, I immediately thought of you, and you and I are in communication even when you're not appearing on the show. You, of course, created DC leaks, so you have a lot of firsthand information about it. Can you summarize the proof? Or obviously, people can go to the John Mark Dougan YouTube channel, subscribe there, and they can watch your whole video about the FBI is lying about DC leaks and Russian hackers. I don't think anybody's going to be surprised to learn that the FBI, and particularly Robert Mueller, are lying. But what's the crux of the issue that they're lying about?
So I didn't actually create DC Leaks as in the website. I set up the server for it. And I show the paper trail that I had all the way back from 2012 when I was doing business with Shinjiru, which is the hosting company that I use. And I show the paper trail for the receipts when I went back to Shinjiru in April of 2016, when I actually rented the virtual private server. And I've been running my own virtual private server since 2010.
Mm-hmm.
Um, so I show the whole paper trail there, and then there's another video that I show you where they were blaming Russia on compromising the Florida voter registration system in 2016, when I was actually the one that did it. That's one of the reasons the FBI raided my
Did
house,
what?
and they know that I did it.
Wait a minute. Did what?
So
You
compromised the
hacked?
Florida voter registration system in 2016.
Sorry, say again.
Compromised the Florida voter registration system in
You hacked it.
2016.
You hacked into it. Is that what you're telling us?
Well, not no, because I exploited a flaw in the public record system, and I show exactly how I do it, and I walk you through each step of how I did it, and I even posted the code with how I did it.
Wow. Which video is that in?
Keep going. Keep going. Keep going. Uh, keep going. Keep going. Oh, it's in the videos.
Right here?
Hold on. Stop. Keep going to the
Well, people can come in here and search for it, but so you found an exploit. I mean, basically, this is the
right
type
there on the very left.
FBI is lying to you about Russian hackers.
Yeah.
Oh, wow, it's got 1,000 views. So, yeah, people are interested in that for sure. And so Robert Mueller, he dropped these charges. I think a lot of people knew there were some problems, just even in the allegations themselves, in terms of the dates, when the company was formed, when they were being accused of
The
doing these things.
allegations were complete crap.
Right. So you blow them away here. But this is part of the reason why the government is basically after you. They have charges against you, and there's virtually no chance that you will have a fair trial. People have seen what's happened to General Flynn, to Roger Stone, to Jerome Corsi, to so many of the people that have crossed the FBI, the Democrats, whatever it might be. You've been at the center of so many of these things. Our first interview, you described how you communicated with Seth Rich. We did a video recently where you were in touch with the Burisma whistleblower, Marina. How is she doing? Are you still in touch with her?
I am. She's doing a lot better. So, but I haven't really been able to do anything with her because I've been sick. So,
And have the authorities expressed any interest in seeing the information that she has? It seems like everything's been superseded by the coronavirus. Nobody seems to care about Joe Biden being corrupt. It's looking more likely that he might become a serious challenger given the crisis that the Trump presidency is in now.
yeah, yeah. Well, you call it a crisis that the Trump presidency is in. I mean, it's really the crisis that America's in. But I got to tell you, could you imagine the havoc and chaos if Joe Biden, who can't even remember what the hell he did yesterday, was the president during this time? Could you imagine what would happen?
Hmm.
It would be awful.
Yeah. I mean, I call it a crisis for the Trump presidency simply because he's in the driver's seat. And if things go south, there's a strong possibility that it'll be hung around his neck. I think that possibility, or, the threat of that possibility in part, may be something that was used to gain leverage over Mr. Trump. I frankly was much more supportive of his position when he was saying that this is an overreaction, that we've had H1N1, we've had swine flu, we've had Ebola, and these pandemics exist. We have strong medical systems, and look, there's always going to be the elderly, the infirm, the immunocompromised that get it, that are at risk, and obviously that's a risk, but shutting down the entire economy of the world seems excessive. So, okay, here's the question that's coming up, John. People are saying, Seth Rich, Burisma whistleblower, coronavirus. How is it that you find yourself in the middle of every one of the biggest stories?
Well, I was dealing with the election stuff and the Seth Rich stuff way before I even came to Russia. Uh, I am a known protector of whistleblowers. I've helped numerous whistleblowers escape from their countries and get to Russia. Um, Most recently, besides Marina, most recently a guy named Michaela Kantila, um, who now that he's here, I kind of doubt his authenticity as a whistleblower, but that's another story. But I still helped him get here. So I have people contacting me from all over the world. I probably get 50 requests a month from people to help them with these kinds of issues. So it's I mean, it just is what it is. And the fact that I have coronavirus is, I mean, look, I had to be in immigration. I didn't have a choice. I needed to renew my documents, and it just happened to be when all the Chinese people were there. So, what are you gonna do? You know?
Mhm. Yeah. And people who are seeing you for the first time, John, they can learn more about you by purchasing your book, Bad Wolf. It seems to be showing up. It's in English, of course, even though the cover here is written in Russian. This is the story about how you created pbsotalk.org and exposed really troubling corruption in the Palm Beach County Sheriff's Office. This caused members of the Sheriff's Office and the FBI to raid your home, take your computer equipment, and basically force you to leave your home in the United States and flee to Russia. It's an unbelievable but true story. And you still have family in the United States. Have you spoken to them? How are they responding to the coronavirus crisis?
Well, my dad's worried. Of course, I'm worried for him because, I mean, he's got almost no immune system whatsoever. I mean, he's been
I didn't
fighting
know that.
cancer.
I didn't know that. I'm
Yeah, yeah,
sorry to
he's been
hear that.
fighting cancer for the last 3 years. My mom died from cancer 2 years ago while I was here in Russia, and I had to say goodbye to her on my phone.
I'm so
Um,
sorry, John.
nah, it happens. It is what it is. Um, and I'm the oldest in my family, so I don't worry too much, because I know that everybody else in my family is healthy.
Hmm.
They're going to get past this, because while they're saying the death rate is 3%, I think it's probably 10 times lower than that. Because I
Lower.
think 10 times the amount of people then actually show that they have it actually have it.
Right.
So, that cuts the figure down to, about what the flu is. Now, that being said, it's not a nice thing to have. I can tell you, it lasts a long time. It doesn't feel good, like in your lungs here, like when you're trying to breathe. Um, it's not a pleasant thing to have, but I think it's survivable by most people.
Hmm. And there's been a lot of talk recently about this malaria drug that they've been using to treat it. Have you been given any medication to treat the coronavirus?
I haven't been given any medication. I can go out and get it. By the way, that malaria drug here is 500 rubles for 60 tablets. So for 60 pills, it's about $8.
Mm-hmm. And have you heard of this guy Boris that Dr. Corsi has been speaking with?
No.
Yeah, he just mentioned him for the first time yesterday, so people are going to want to check out Dr. Corsi's channel to learn some more about that. So, John, let's talk a bit. You were a former law enforcement officer, and I'm just looking at this. This is some local news here from Daytona Beach. The Daytona
Hmm.
Beach, which is kind of close to where you used to live, Florida. Spring break
Yeah,
going
sure.
on there now.
2.5
Coronavirus is
hours north.
forcing inmate releases from jail in Volusia and St. John's. State prisons go on lockdown. What do you think about the idea of releasing prisoners as a response to coronavirus?
Well, I think it's smart, number
Why?
one. And I'm going to tell you, well, I'm going to tell you why. Because most of the people in prison in the United States shouldn't be in prison.
Hmm.
Most of the people in prison are nonviolent offenders. And, it's just a way for the prison system, it's a way for these private corporations to make money. And most of them shouldn't be there. That's just the reality of it. I was a cop, and some of the things that I used to see just blew my mind. So I think most nonviolent offenders should just kick them loose, because who's going to be responsible for taking care of these inmates when we have huge pockets of people breaking out with coronavirus because they can't isolate them properly? It's going to be the American taxpayer, and that's crap.
But don't you think that there's a danger as these cities go on lockdown and prisoners are released who maybe don't have a family or a financial infrastructure to support them, that they might immediately turn to crime? I mean, I'm thinking, of course, about this Ho Chi Minh quote that when the prison doors are open, the real dragon will fly out. Is this a Marxist, jihadi, communist, unseen previously revolution that's happening right now?
Well, that's a good question, and I don't know. I think a lot of people do have families, and they might have a support system. Some people won't, of course, and I don't know what to say to that. But I mean, look, they're not going to let murderers and rapists go. That's clear, unless it's maybe somebody who served almost all of their time, you know. But they're just not going to let out the violent offenders. They're going to let out people who are in on petty drug possession and stuff like that. And I think it's probably a more effective way, um, because look what happened on the cruise ships. They had all those people in those cruise ships, and at least half of them ended up with coronavirus because they're in such a small place. And is not prison is not as isolated as being in a cruise ship. You know,
Hmm.
you got the
Wow.
open bars.
You're right. Well, prison is not as isolated as being on a cruise ship. Well, I wonder if people will
Well,
start
no,
vacationing in prisons.
not when you're stuck in with everybody.
Right. Right.
At least you have doors that you can lock on your cruise ship.
Right.
In prison, you have open bars, so when somebody sneezes, your breath is like going all over the place. I
Hmm.
mean, it would be really, really bad if coronavirus found its way into a jail.
Yeah. Well, We've got Dark Horse with us in the comments saying that Trump is in a trap and that if he blows this off, he'll be blamed for every death. See, I agree with that because,
I agree with it too.
yeah,
I I think Trump did the right thing by downplaying it and not putting everybody in a panic.
I agree.
But by downplaying it, he's got the other side saying he's not taking it seriously and then he's blowing it off. I
Yeah,
mean, he's really damned if he does, damned if he doesn't.
exactly. And that's why I've been saying that they basically put him into checkmate, where they said, look, this is what's happening, and either you're on board and we can minimize the damage to your reputation and your legacy, or you're going to be the first guy to go.
Yeah. Yeah.
Mm. Now, John, you've also been doing an amazing investigation. So you told us earlier how you found this exploit and were able to access voter database information. People can go to the John Mark Dougan YouTube channel to learn more details about that. Incidentally, we're doing a simulcast of this video on John's channel right now, so people can watch on John's channel and comment on there. But you've been doing an investigation into what seems like extremely obvious voter fraud. You found, it was, I believe, over 100,000 voters who are over 100 years of age, some as old as 140, 160, ages that humans obviously cannot live to. What are you concluding in this investigation so far?
So look, so what I found is there's 110,000 people over the age of 100 that are registered to vote in the state of Florida. Of those, 10,000 of those were recently registered as recently as 2014. Okay, we're talking people that are 163 years old, registered to vote in 2014, and out of those, at least 1,000 people over the age of 115 years old voted in the last election.
Over 115 years old.
At least 115 years old and older voted
Wow.
in the 2016 elections.
Wow.
So, yeah, so it's a very scary thing that's happening with the voting fraud, and
It is.
I break it down on my channel. People can watch it, and I'm doing a video now where people can actually get the data themselves and analyze it themselves. So.
Yeah, because there's a lot of people putting comments in here. They're, skeptical of some of the things that you're telling us, but you've got all this evidence here for people to see. I have to tell you, John, when I first saw the video where you announced that you had been diagnosed with coronavirus, I was skeptical myself. But when I saw the video that you produced where you were telling people the symptoms that you were having and then it wasn't such a big deal, I was very interested in that because everybody else who's talking about coronavirus, as you've been saying, is sensationalizing it and trying to make it seem like it's this end of the world kind of thing. We even saw a guy on CNN, I think, it was an American guy who's married to a Chinese woman who has a Chinese-American daughter who supposedly had coronavirus, and he's sharing a water bottle with her. She's coughing. It seemed bizarre. So I really appreciated your more level-headed approach to answering people's questions about it.
Yeah, well, and I have a friend with me, sitting over there.
Isn't he or she worried about getting coronavirus from you?
Well, she was sick for a couple of days. She's younger, very healthy. She was sick for a few days when I started getting sick. And she didn't have any other symptoms other than those couple of days, so that this is why I'm saying if you're healthy, I think the risk is pretty minimal.
Yeah, and there's doctors who have told us that. I was outside Mount Sinai Hospital here in New York the other day. I think it used to be St. Luke's, maybe it's still St. Luke's, but it's on 59th Street, and I spoke with a doctor who wasn't wearing a mask, who told me that he was treating coronavirus patients and that his number one priority was not to infect other people. So I asked him why he wasn't wearing a mask, and he explained that this disease has been in the public since November or December, and that it's been spread all around, and that everybody who has it basically has it, and wearing a mask is going to do nothing. But again, to allay people's concerns, there are a lot of viruses in our bodies all the time, and healthy immune systems keep them at bay and prevent us from becoming sick and getting overwhelmed by these viruses. I mean, I think anytime you blow your nose or spit, there's bacteria, germs, viruses of all kinds in there. And the other thing that now multiple doctors have shared with me is the very sound medical theory of herd immunity. And I'm not talking about vaccinating everybody. I'm talking about the proposal that was initially being exercised in the United Kingdom, where young, healthy people who have normal immune systems and aren't medicated and aren't transplant patients and aren't having cancer treatments and things like that are encouraged to conduct their normal lives and intermingle in public as if nothing is happening, so that the disease can be spread around and we can collectively develop antibodies against the disease. And just as you are right now, some people will suffer through a week or two of uncomfortable sickness while the economy and stores and restaurants carry on. And the world doesn't come to a grinding halt, which we're experiencing right now. This is weekend one. I think everybody is still feeling like this is kind of like a bizarre, unplanned family vacation. I'm becoming increasingly concerned what happens next week, the following week. We've heard this could go on until August.
Yeah. And, I think England has the right idea, because it's not the young ones that are really dying, and it's not the healthy ones. It's the old and sick. And they need to stay in quarantine like my dad. But I think England has the right idea with what they've been doing. And, I think the U.S. should follow in the footsteps.
Well, unfortunately, the UK has reversed this policy. I don't know why, but again, multiple doctors have told me that it would be a prudent step for young people to do that. I mean, here in the United States, this is not an appropriate article. It's from a year ago. But here in the United States, I mean, people are sending me, very limited number of people, but some people are sending me angry messages for even going out on the street and trying to cover what's going on in New York City. I think it's important that people see the evolving sort of temperament of the city. I was out last night just walking around, and I detected a vibe that was... things could go south quite quickly if this isn't handled properly.
Yeah, I think you're right. And I do see what I see the point about flattening the curve. But I think well, I mean, just look at what's happening to the economy because of it. It's again. Like my friend Lieta over here, she's handled it very well. Yeah. So, and I'm not young. I mean, I'm not old, but I'm 47.
Well, that's young for the demographic that is allegedly affected by this. You're not over 70.
And I have high blood pressure too, which is like a major contributor. But and maybe that's why I'm not handling it as well as someone like Lieta. But yeah.
Right. Well, see, and now this is not necessarily the best practice. Going out and getting drunk is not something you should do if you want to keep your immune system strong. But I think what they mean is going to work and continuing to go to offices and run stores. I mean, personally for me, I think it would have been way more prudent for, the governor to give guidelines and things like maybe to advise that restaurants remove 50% of their tables or 50 to 75% of their tables. At least that way businesses could remain alive in kind of a limp home mode until we figure out what to do and get a better handle. I mean, the other thing that I found very difficult to process was that we heard that even though when I went to three of the largest hospitals in New York City, there was absolutely no indication whatsoever that anything unusual was going on there. In fact, they looked remarkably calm to me. Um, We've heard that there's this growing outbreak here in New York and that it's going to overwhelm the hospitals, and that by next week we're going to be, knee deep in all these coronavirus cases that the system won't be able to handle. So we need to shut everything down now. My concern is that if we wait a week or two with no commercial activity, it's going to be a cascade of failures. I'm thinking about my own small business, my previous small business, and how I would have been able to respond to something like this. $1,000 from the government would not have made a difference, and payroll and rent and everything can overwhelm people quite quickly.
Yeah, well, I believe it or not, I'm falling into that category because I was working for a U.S.-based company, and I've since been they've since stopped their business, and it's really I don't know what the hell I'm gonna do now.
Right, because you were
So
doing contract IT work, which obviously you can do remotely. But this is what I mean. This economic slowdown is going to have universal, far-reaching implications. I've been seeing a number of European air carriers shutting down, basically
hmm
stopping operations. Cathay Pacific has halted all of their operations. And I mean, so if they find out tomorrow that coronavirus is under control and you can take this $8 pill if you get it and it's not life-threatening, there's still been all these businesses decimated. Chris Collins is telling us that Forbes on September 1st had an article saying that Huawei has just launched 5G in Russia. Do you have 5G on your cell phone, John?
Well, I don't have a cell phone that supports 5G, um, but I have friends that do, and I would love to have a 5G cell phone, but I can't afford it right now. Um, but yeah, people don't realize that internet and mobile service in Russia is some of the best anywhere. Um, and yeah, but I would love to have 5G.
Hmm.
I just don't.
You're not concerned about these reports? People have been saying 5G is going to cause cancer and the phased array technology is dangerous.
I don't know. Show me the research on it. I mean, they say everything causes cancer.
Right.
So,
Well, and that's my response as well. There is a lot of research, but then again, sometimes I see people telling us 5G is dangerous, it's going to cause cancer, and then they go smoke a cigarette. And I also consider,
yeah.
automobiles technically cause cancer, right? They're spewing carbon monoxide and all kinds of other chemicals into the atmosphere. I'm sure when cars were introduced, whoever was selling horse buggies probably had a lot of research about how dangerous cars were. And that's not to say that I don't think that 5G is dangerous. I'm just not sure where the balance is between a technology that's beneficial and a technology that's dangerous. Guy Wilson has never owned a cellular device. Some people are protected by that. But even if you don't own one, there's radio signals all around us bombarding us all the time. And, John, for people who are feeling like they want to learn more about you and can also help you with the financial downturn, your book, Bad Wolf, The True Story of an American Cop's Retaliation Against the Corrupt System of Justice and Politics, forcing him to seek political asylum in Russia, is not only essentially the longest title for a book that I've ever seen, it's also available on Amazon.com, and people can get it immediately in the Kindle version, which is a good way to avoid waiting for anything to ship. If anybody is nervous about physical items coming into their house, possibly with coronavirus on them, get the Kindle version and read it. There's going to be a lot of people looking for ways to fill their time. I don't know, John, what else can we say about this?
I don't know. You did a good job.
Yeah.
Um,
So your symptoms
yeah.
have gone away for the most part. I notice you're not coughing or sneezing or.
I was coughing earlier this morning. But once I'm up, things kind of settle down a bit. Um, and I haven't really sneezed a whole lot, but I do have a fever and my head is just killing me.
Mm-hmm.
But and if I take a deep breath, I mean, I feel it's like I'm breathing in hot air. But I mean, but really, it's like the worst of it. Oh, somebody on my channel just said, "Great book, I read it in 2 days." Nice.
Nice.
Yeah, but you know, uh, if you want to, if you want to ask somebody else what
Yeah,
their symptoms were,
absolutely.
you're welcome. Yeah, hold on. Here, come. Smile.
Привет.
It was задержка. With pause, yes?
Yeah. No,
Привет.
go ahead.
Hello.
Hi, how are you? Leta is your name?
Oh, my name is Lera. I'm fine.
How are you? You have coronavirus?
No, I don't think so.
But aren't you worried sitting right next to John there? He's got it.
Say again, please.
Do you have coronavirus? I think we just went to mute. We lost your sound. No sound. You got mute. Put in a comment here so that they know. You got no
Can you hear?
sound. Yeah, now you're back.
I can hear,
Yes.
but he can't hear.
No,
okay.
we're back.
I thought I have it maybe one day, but I don't know. It was coronavirus or what. I just have some bad feeling. One day, some sickness.
I mean, it's inconsistent with what the United States mainstream news is telling us. They're saying it's a deadly virus and everybody is super afraid of it. People in Russia are not afraid of coronavirus?
People in Russia afraid, yes. If you go into the street, you could see people. They walking in masks. They don't touch each other. They try to not not
Get
be
close.
close. Yes, not get close to each other. And they every time washed their hands and make it antiseptic.
Right. A lot of people using the hand sanitizer, correct?
Yeah.
We've been told that hand sanitizer can actually be more dangerous, that it uses chemicals to kill bacteria, and some of that bacteria is actually helpful. Someone is saying they thought I had more sense than this. I don't know what Kent Lawson is talking about.
Well, yeah, I mean, we've been hearing this for years about like the antibacterial soap and things like this.
Right.
We've been hearing this for years.
Thank you. Spasiba.
So we've been hearing this for years about how antibacterial soap is not beneficial. So
Yeah, I never use hand sanitizer. I hate that stuff. I hate the way it makes my hands feel. But it's interesting. I mean, you guys are having a much different experience with coronavirus than what we're being led to believe here in the United States. Lula reminds us that every day new strains of viruses float around. I agree. I mean, I'm not scared of the virus. A lot of people saying they don't trust you, John. What would you say to the people who don't trust what you're telling us?
well, I don't know. The people in the coronavirus suits weren't here testing me for nothing. So, I mean,
can we show these people? Did they send you some kind of diagnosis or some report or something that we could show?
No, they just call you on the phone.
And they said, you've got the coronavirus. What does this say here? This is the hospital?
Moscow, Gorodskaya Center. Listen. What is this? What does this mean?
Moscow Central of disinfection.
Of disinfection.
Yes.
The
The
Moscow
Moscow
Center of Disinfection.
Center of Disinfection.
Mm-hmm. So they
And
were over
anybody
there
who's
at the house.
diagnosed, they send these people over to clean their to spray, like clean all the door handles like that, the elevators.
It's a very nice apartment building. It looks newly constructed and tall.
Oh, we have a lot of nice buildings in Russia.
Yeah.
Oh, yeah, actually, you notice we have 13 floors here.
Uh-huh. I see that, yeah. Every building has a 13th floor there.
Yeah. Well, I know, but usually it's not on the elevators in the United States.
Right. Definitely true. Well, John, we're getting close to the end of our hour here. Anything else you wanted to discuss?
No. Unless you have any other questions.
I mean, I think we've covered most of what I wanted to get to. You've got the YouTube channel where you are going into lots of different investigations. People are also talking about how you had these videos from the detective in Florida who had the Jeffrey Epstein evidence. Has anything else happened with that?
No. That's everybody knows my position on that. And
I don't know if I know your position on that. What was your position on that?
my position is it's a dead man switch.
What is?
The videos.
You're holding them, it's your dead man switch,
Yes,
meaning they don't get released unless something happens to you.
that's correct.
Yeah, I mean, I don't want them to be released. I'm just saying, why hasn't the FBI, I mean, why don't they say, hey, give us this evidence? I mean, they're obviously not prosecuting.
They have that. They have it all.
They have it.
They took my computers, so they had an exact duplicate of everything I had.
Ah. Ooh.
Yeah, they have it all.
Now, wait a minute. Danny points out that the top floor of the Russian apartment building was 33. Is that correct?
No, I don't know. I
31.
live on 18.
31.
Yeah.
Yeah.
Why?
Well,
Oh.
because this number 33 seems to show up all the time, and I've called it out as a steganographic marker. We saw it in that Guardian article about Saddam Hussein in the oil for food program through the UN, selling oil essentially for euros. That spoke about 33, which could have meant that they did that for, I don't know what it means. I just notice it appearing all the time. So John, I think we're going to wrap it up here. A lot of people want me to go venture out into New York City and see what's going on today. I received a number of emails from people yesterday with video of military vehicles rolling through the streets of New York City that were allegedly photographed yesterday. I doubt the authenticity of that evidence. I want people to keep in mind when somebody sends them a video, they should start questioning it immediately. A couple things that stuck out to me, John, the videos that I got had no sound, which seems weird because that
is weird.
For most
everybody records on
their phone.
Yeah.
So actually removing the sound would be more difficult for most people than just uploading a video with sound. So the fact that there was no sound was very strange. I also want people to remember that even if you have a 5-year-old cell phone, an 89, like a free cell phone now, has a 4K video camera in it. So why would we have such a low resolution video of this thing? It didn't make sense to me. I saw no military vehicles on the street yesterday, and I went over to the armory. I'll do it again today. I went last night just to check, and I saw no activity outside the armory. September 11th, there were military vehicles parked all around there. Even sometimes on a regular day, there's a couple military vehicles there. But I want people to rest assured that I saw no indication in New York City that martial law was coming. I did see a lot of sketchy people, not a lot. There were hardly anybody out on the streets last night. But who was out seemed sketchy. And I'm concerned as we go week 2, week 3, week 4, if this goes on until August, that could create a pretty desperate situation.
Yeah, which is, look, I had to go to the grocery store 2 days ago, Um, I had my mask, and I mean, look, the world can't stop because of this.
Yeah. Yeah. Well, John, thanks for joining us. I hope that you recover soon. Have they given you any indication as to when you might recover, or do you think you might get those $8 pills and try them?
Yeah, I'm probably gonna pick those up tomorrow. Um, and again, they're $8 for 60 of them here. They're $8 per pill for you guys.
Right.
But yeah, but I'll probably pick them up tomorrow. Um, is I don't think there's any time frame that somebody should be recovering from coronavirus. I think it could be a day or two, like Liera, or you know 2 or 3 weeks, like me. And I just wanted to clarify something. Somebody asked a question on my channel,
Hmm.
if my blinking is because of my headache. No, my blinking is because I have Tourette's syndrome. So sometimes, especially when I'm tired or if I have a beer or something, it gets a lot worse. So I just want to point that out to people.
Yeah.
My blinking is from Tourette's. It's not sending signals or from my headache or anything like that.
Yeah, a lot of people ask that every time we're doing shows together. So I appreciate your patience in answering that question. And I appreciate you
Oh yeah,
joining
no, it's
us.
fine.
It's great to have you on the show, John. And, we'll have you back as there are more developments. I definitely want to speak some more to Marina. I don't know that the Burisma issue has nearly as much importance as it did, say, a week or a month ago, but she's still an important witness. And thanks to you, John, maybe people will hear her story. People can go to the John Mark Dougan YouTube channel and subscribe. They learn more about you there. They can watch simulcasts of our videos. They can learn about your investigation into Florida voter fraud, which is definitely very interesting. And of course, people can purchase the book Bad Wolf from Amazon, get it on Kindle or paperback, and read all about John's escape from a corrupt justice system here in the United States, something I think a lot of people agree we have. So thanks for joining us again, John, and have a great night there in Moscow.
Thanks.
And thanks
Thanks, you
everybody
too.
for watching. Have a great day.